Good afternoon, everybody. I hope you had a beautiful 4th of July. Being after the 4th, the 5th, everybody had their partying and fireworks and enjoyment. And now we're just going to take a minute and we're just going to calm down our nervous system. Today we're going to work on our vagus nerve. Vagus nerve, it controls the body's fight or flight mechanism, and a lot of people get stuck in fight or flight mode because of the way that they're breathing, and it's just the way things are today. Everything is just so fast paced that people sometimes have difficulty slowing down, moving at a slower speed. So that's all we're doing today. So the way we're accessing the vagus nerve is going to be through the ear, and a little bit of self-care and self-love in this routine is really instrumental in help calming down the nervous system. Okay, and all you want to do is make sure that your fingernails are trimmed, because you're going to be putting your fingers in your ear. Okay, I recommend, if you don't have fingernails that are trimmed, you just grab a simple hand towel. Just a simple hand towel like this. You can wet it. Sometimes wetting it, the towel allows you to get a little more movement. Okay, and you can use this, and it won't be as uncomfortable as jamming your finger into your ear with your fingernail, right? So, okay, for the beginning part of the exercise, our thyroid cartilage, we're just going to massage our neck. A lot of people have anxiety and tension issues, and it really traps your muscles into functioning in only a single state. And it's really by changing the cycles. Without knowing that you're able to go fast, you wouldn't know that you're moving slow. And without moving slow, you wouldn't have that comparison showing fast. Or without good, you couldn't have bad. So everything's always there at the same time. And that's all you're doing, is you're just allowing any release that might be present. And a lot of times people will get swallowing issues. When you swallow, there's a lot of muscles working together. People have IBS, acid reflux, and it can be from many different things. And it's so difficult for doctors to tune into exactly what it could be that is causing these problems in your system, because it's just one thing's out of alignment, therefore it knocks something else out of alignment and knocks something else out of alignment. And by the time you're saying, hey, I'm having difficulty swallowing, well, your posture's out of whack, you're anxious all the time, the stress is in your body, you haven't figured out how to release the tension in a positive manner, and it just keeps building up and accumulating and getting further and further from a baseline that you're accustomed with. And really what these fascial maneuvers and these stretches are doing is it's allowing you to say, okay, I'm adjusting myself, this feels really good, now this is my baseline, and from here I know how far out of whack I am before I need to do another readjustment to get myself back to the baseline. And then you're not steering further and further away from where you should be. So your thyroid cartilage, and you just really just giving yourself It's self-love, guys. It's just a simple massage. Okay. And notice by doing that, and then you slowly start working your way up to right here behind the between the lower jaw, right where this bony protuberance is, and you're just gonna apply some slight pressure, and it's gonna feel slightly uncomfortable. It doesn't feel good because a lot of people, they have their heads in a forward position because they're on the phone or they're on the screen, and by having that forward head tilt posture, it really knocks everything out of whack. Your spine, as it should be, your ears should be over your shoulder blades. And you should be like this. And as awkward as that feels, that used to be the norm before everybody started getting on their phones and on the screens and everything, okay? And we're just slowly adjusting the posture back and getting that baseline, all right? It's good to push right here and use your tongue to push up on the roof of your mouth while you're applying pressure using both hands. You can do one or the other if you like. And just really get into the rhythm of breathing. Breathe in through your nose and breathe out through your nose slowly. Just gentle breaths, letting the air fall out. And then the second type of breath work is breathing in through your nose. Nice slow inhalation. And then breathing out through your mouth for the second breath. And it's just letting the air fall out. It's not forcefully pushing out. You're just letting the air fall out. Okay? Low resistance, just calm is what we're looking for, all right? And while you're doing that, you can slowly go up here to the ear and slowly massage around the ear, okay? Now, to get to your vagus nerve, they have a lot of electronic stimulation devices that attach right here to where this little flap of skin is, where your ear is, and it'll actually clip on there and send electronic pulses through. You can buy these devices, but you don't need to buy anything because you could just do it yourself, okay? I found that anything that you can do for yourself is a lot better than having to go and get it done, because then you're the one that's relieving the anxiety, the stress, the symptoms for your cause versus, oh, I have to go here to get it done. No, you don't have to go anywhere. You could just do it yourself, okay? And just by squeezing this cartilage, and remember, if you have a wet towel or a dry towel, even if you have fingernails, you can go ahead and go through it like this and just applying pressure to your ears, all around your ears, okay? There's a whole bunch of acupressure points, and you just apply pressure. Just this is a calm self-care exercise. You're not trying to max out bench presses or CrossFit or trying to take it to the extreme. You're just really just releasing the tension that might have been built up in your neck from a long stressful day or a long stressful week, depending on when is the last time you gave yourself some care, some love, okay? And that helps really calm the vagus nerve, okay, and the thyroid cartilage, your neck. It'll help adjusting with the swallowing, okay? People have trouble with dysphagia or hiatal hernia or any type of acid reflux. And a lot of times those symptoms have delved in from possibly that you're just in bad postural alignment and everything is just so out of whack. Your lower body's trying to adjust for your middle back, and your middle back's trying to adjust for your upper back, and it's trying to adjust for your neck being forward, too far forward instead of back far enough, and it's just, we're just trying to find a baseline and get back to where calm is, okay? And another method that I have to find calm in chaos is just giving yourself a big hug, okay? Now for this, it's a fascial release, okay? Call it totally twisted. And you just stand up straight as possible. Feet, if this is your foot, okay, your front big toe, your pinky toe, and your heel, those are the 3 points, all right? And you want to have your feet flat on the ground and really grounded in the ground, okay? So your posture will be like this. Remember, you're doing diaphragmatic breath work. Instead of just breathing in and out through your lungs, you're really using your diaphragm all around, not just your belly, but all the way around to breathe in and to breathe out, okay? And while you're doing this, you're going to cross your right leg over your left leg, all right? And your right knee is going to be in front of your left knee, and you're going to kind of like you're hula hooping, but not fast at all. You're just going very slow. And you're using your breath work and the 3 different types of breathing. First being in through your nose, out through your nose. Second being in through your nose, falling out through your mouth like this. And the third type being like you're inhaling your lungs like a balloon, which is like this. Just letting that breath fall out, okay? Not forcefully pushing it out, but you do want to use the breathing like you're inhaling through a tube to really fill up your lungs, to really fill up that diaphragm, and you'll be amazed that with a conscious breath, how much air you can actually get in. Remember to constantly have your belly button, your belly breathing, okay? Not directly only through your belly, but you're using your diaphragm. And you're pushing it out, but then you're also, where your belly button is, you're sucking that into where your spine is. And your pelvic floor, your bladder and everything, you're sucking that up into its proper area. And by doing that, you're going to notice that you really get a lot of release in your lower and mid back. A lot of that area, especially on myself, I'm a very tense person. I have a lot of anxiety, and I've always had an issue with dealing with it, and this is one of the best ways that has helped me to calm down my central nervous system, calm down my anxiety and anything that is stressing me out, and just giving me a good baseline to go about my day. The exercise takes maybe 5-10 minutes, okay? And you're going to go ahead and put your right hand over your right shoulder, or your left hand over your right shoulder, right hand underneath. So you're giving yourself a big hug. And what this is doing is it's restricting your lungs, okay? You're giving yourself a calming hug, and it's been shown that even if it's just hugging yourself, it tones down your sympathetic nervous system, and it really helps calm you down. They have the weighted blankets and things like that go into that type of calming the nervous system with the weight. But you can easily just do it just like this. Nice big hug. Really use those 3 different types of breath work to, and breathing from the inside, you just want to stretch from the inside out using that breath. And you'll tilt your head all the way to the right. That's why we put our left hand on our right shoulder. And we're slowly twisting our midsection to the left. So the head's twisted first to the right, twisting our midsection to the left, always maintaining stability and balance. Okay? And really get in there with your breath. And you can stretch out your hips and your lower back, your mid back with all that breathing. And you can go at different angles and just really get a nice good stretch in there and hold that tight hug. It makes a big difference. And breathe. Maybe do 3 of each breath or 6 of each breath. You know, the in through your nose, out through your nose, in through your nose, out through your mouth, and then the balloon type inhalation, just to really stretch everything out. Okay? And then once you're done with that, face center towards the middle. Remember, elbows are straight on top of one another, and we're just going to switch it around. You're just going the opposite way, elbow on top of each other, just like this, with your left head. Your head tilted towards the left where your hand is. Okay? First in this direction, then you're slowly spinning your midsection to the opposite direction, the right, using your 3 different breath patterns. And make sure you maintain focus somewhere in your room, because sometimes there will be a lot of overload because as your spine's releasing, you tend to see, sometimes you get spots, you get dizzy. So it's good to have a focal point to maintain a sense of balance without being overwhelmed or overloaded. Make sure you do nice, calm, deep breathing for that. And then bring it all the way back to the center again. Okay, with this exercise you might feel a little bit lopsided because you haven't done the other side yet, and that's okay. We're just going to switch over to the other side now. So you're going to do your left leg, cross over to your right. If you need more balance, you have trouble with balance, you can spread your legs a little bit further, but just make sure your knee is in front. And like I said, you're able to have movement with your feet flat on the ground and still maintaining stability so you're not going to fall over, okay? And you're going to do the same direction. Left hand on the right shoulder, right hand underneath. And we start this way, that's easy to remember. That way you could put your chin over here, okay? Your chin on the right. And then you slowly twist your midsection to the left. Slowly implement your breathing. Make sure your feet are flat on the floor. Making sure your belly button is tucked to the back of your spine. You're breathing out through your diaphragm. I got a nice release right there. And you'll find that sweet spot where you're able to get that nice adjustment. And sometimes when I do this adjustment, sometimes I only get 5 or 10. Um, and that just means your body is not in a tense state as it was before. And that's okay. That means that this exercise is working for you, okay? It's in the beginning when you first start doing it, when your back is just like crack, 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 and you're like, whoa, what is going on? Because in the beginning, when I first started doing these fascial releases, my fascia was just so tight and tense, and it was just very difficult to even loosen up a little bit. And you'll notice as you slowly keep doing this, this is not a contest to see how much I can accomplish in the one given day. It's just over a period of time, learning where your baseline is, learning how to adjust yourself, and being able to calm down your nervous system. Okay? And with these big self-love hugs, squeezing down your lungs, and I'm not pushing down where I can't breathe or anything insane, but it's just a nice cozy hug type sensation. Okay? Bring it back to the center, and we're going to switch. Okay? And we're going to put our head on our shoulders, our head on our left shoulder turning to the left, and your midsection going to the right. I just got a really nice release. Remember, your posture is very key in this. Standing up straight, you'll get a lot more release in that back, lower back, mid back. And really use your breath work. In this direction, I seem to be very tight. Sometimes I like to close my eyes, but that gets a little dangerous because I really like to feel the stretch. But once again, you'll get overloaded very easily because your spine is releasing, and sometimes you'll get very dizzy. So be careful with that. Try to focus on a point in your room or a point anywhere outdoors where you're able to lock on to a certain spot with your eyes and stop the so much overload. Input overload is what you're having. Oh, my back just cracked really nice right there. And like I said, this is just self-love, guys. That's all it is. You're just giving yourself 30 minutes of love, 15 minutes of love, 5 minutes of love, however much time you have to give yourself. But it is really imperative, instead of taking it as, oh, it's just going to happen anyways. Yeah, your body's going to get overloaded and you're going to get out of alignment anyways, but it's very important to adjust back to the baseline so you're not so far knocked out of balance. Okay? Remember, wherever your head is tilted first on top, and then you move your midsection. My back just cracked there too. You don't want to go as tight as possible or as taut as possible, where, oh, I got to twist my back so hard I got to get this crack. No, and we're not going into it like that. Just accountants of peace, no anxiety, no stress, just being calm and just slowly stretching. I do this exercise, like I said, at least once a day. Occasionally I'll skip, but I try to do it at least once a day, sometimes twice a day, just to really loosen everything up, and afterwards you'll just feel so much better. Let me know in the comments below if this has helped you guys as much as it's helped me, because before I was doing this, I was just, my spine was just constantly like this. I mean, I'm not the most flexible person as is anyways, but I'm just always tight and tense in my lower to mid back. I've always had troubles with being flexible. And this type of stretching, fascial maneuver, fascial releasing has really tremendously helped me a lot. That and Kava. Shout outs to Heritage Kava. I love you guys. If you guys haven't tried out Heritage Kava, I recommend you try them out. You can get it on Amazon. Some of the best kava. I've noticed, this is just a bottle. I poured it in a plastic bottle. But I've noticed that with Heritage Kava, their kava it's not micro, but they grind it up really fine. And it's a very nice, calm, potent kava for what you can get off of Amazon. I think it's like $55 for a pound of kava, 16 ounces. It comes in these 2 air sealed bricks. It comes with beautiful package from Heritage Kava where it explains everything about the grower, the farm, just really beautiful packaging. And it was so good I drank it so quick. This really helps out with anxiety and calming just a stressed or anxious state. I recommend that to everybody as well. You can find it on Amazon. Once again, Heritage Kava. They have a premium, which is the yellow box, and they have a regular, which I think is about $10 cheaper, but for $10 you're buying a pound. Why not spend $10 more and get the little bit stronger one? It's not going to be anything like a benzo. It's a herbal supplement, but it will help to calm you down. There's a lot of people that have taken kava to get off of alcohol addiction, opiate addiction, benzo addiction, whatever kind of addictions that you might have, where you just need a little bit of help because maybe those withdrawals from those other substances are very impactful to your system, and this will help take the edge off of it. So thanks to everybody over at Heritage Kava. I love you guys. This was not paid sponsorship from them or anything, but I just really enjoy their kava. It's really good. It's creamy. I'm going to be doing more reviews on kava, reviews on probiotic sodas, kefir. I've been doing a lot of gut health because there's a connection between your brain and your gut health. And I believe that all the kefir, gingerbug sodas, anything fermented really has a dramatic effect on your health and your well-being as compared to just going and putting all kinds of junk inside your body. So this video is a little bit longer than I thought it was going to be. I was just going to go over some fascial stretching maneuvers, calm down the vagus nerve and everything like that. But things don't always work out how we plan it. So I hope you guys enjoyed this video, and stay tuned. Check out another video later. You guys have a beautiful day.